My name is Antonio Terranova. I'm a breast radiologist, Italian doctor. I was in charge for more than 15 years in breast checking public screening in Italy. Now I offer you my experience in Ireland. The breast cancer is a huge problem all over the world. Every year the number of breast cancer is increased. Fortunately, the number of deaths for breast cancer is decreased. Now the problem is that the age of breast cancer is going down, and now there are many women in their 40s that have a breast cancer. The problem is that the only option we have to save that life and to save and to change the prognosis of these women is to find out a tumor in early stage. It means to find out a tumor when it's less than 1 centimeter. So it's necessary to have a mammogram before there is any symptom. Because normally we say that breast cancer is palpable when it reaches the size of 1 centimeter, 1.3 centimeter. Fortunately, with the mammogram, especially with the digital direct mammogram that we use normally, it's possible to find out a cancer when it's about 3-4 millimeters. So I strongly suggest every woman without symptoms in their 40s to undergo for a mammogram every year, because it's the only option we have to save that life.
My name is Aideen. I work here in the Galway clinic. I'm clinical specialist in mammography and I work in our breast imaging service. I have been here almost 6 years now, and I have previously worked with Breast Check in Dublin. Breast cancer is one of the most common cancers amongst women in Ireland. 1 in 12 women will develop breast cancer in their lifetime. Breast cancer cannot be prevented, so the aim is to detect it as early as possible. This here is our new digital mammography machine. It is state-of-the-art equipment for breast imaging. The majority of mammograms performed here will be negative. Should it appear positive, referral to a breast surgeon will be organised. When you arrive for your mammogram appointment, you will check in at our radiology reception desk. Here, the clerical staff will ask you to confirm your name, date of birth, address, and referring doctor's details. You will then be called from our waiting room by using a confidential buzzer whereby your name will not be called out in our waiting room, and you will be taken to this room, our mammography room. The door will be locked behind you to ensure your privacy at all times. This is a very private and confidential area. In this room, you will only be x-rayed by female staff. We will then sit down and have an informal chat, and I will ask some questions with regard to your current health and the health of your breast. You will then be asked to undress from the waist up behind this curtain. Your mammogram will consist of 4 pictures, 2 forward and 2 from the side, to ensure that we visualise all of your breast tissue. You will be asked to stand in front of the machine as so, to lean in so that your breast tissue will fall in and rest on the machine, like this. I will then lower this part onto the breast and apply some pressure. This pressure will only be on your breast for about 3 to 5 seconds, and as soon as I take the image, the pressure will release off automatically. We will then perform the 2 side views. These will ensure that we visualise all the back of the breast and all the underarm. You will be asked to step towards the machine, to raise your arm and place it here, and then to lean into the machine. Once we have performed the 4 images, your mammogram is then complete.
I like to underline that after the mammogram I can see immediately the image in my monitor, and I can do immediately a report for the GP that receive this report with the relative images in 2 days. So I strongly suggest every woman to undergo every year a mammogram, because the only option, I repeat again, to save that life is to find out a cancer without symptoms. It could be strange for a woman to go for a mammogram without any problem, but it's the only option.